All right, so you're the host now, and it is recording, but don't feel like you have to start immediately. I know everybody comes in, a couple minutes usually
Yep.
afterwards. So feel free to start whenever you're ready. And like I said, it'll just send me the recording.
Awesome.
Thanks.
Thank you. All right. I'll just wait a couple of minutes for people to jump in if they want to. Just waiting 2 more minutes, and at 5, we're gonna get started. let's start. So welcome everyone. Thanks for joining me during your busy day. Today I'm going to talk about drug-induced urinary retention. I am Florian. I'm an internist in Paris and also a second-year ACVNU resident with Tufts in Montreal. And so I'm going to tell you a little bit of my disclosure. So apologies, this is not a standard journal club presentation. It might be super very nerdy, so I hope you're going to follow me around. This presentation aims to dive into some neuroscience and hopefully to open up to some nice discussions with you guys. Hopefully you'll be able to follow my train of erratic thoughts. Don't hesitate to tell me if I'm losing my mind, if I'm making things up. It's going to be interesting for sure. All right, the context leading to this presentation started a few years ago with a German Shepherd dog, Mabruk, which was a 7-year-old intact male dog who was presented for a second opinion on perianal fistulas. Everything started in June 2022, where the first fistula appeared. A year later, almost April 2023, tried some local tacrolimus and disinfection with no improvement. And then they ultimately started giving corticoids in May 2023. What's interesting about this dog is that a few days later, the owners reported complete urinary obstruction and then came for a urology consultation, ended up getting a cystoscopy, which was completely normal. They didn't have a contrast study at that time. And so after the cystoscopy, they ended up doing some alpha blockers, and they also tried to taper down the PRED, which resulted in a complete urinary deobstruction. At the end, Mabruk ended up getting cyclosporine for the treatment of perianal fistulas, and you have nice pictures of pre and post-treatment below. No other urinary events, and then eventually died of splenic hemangiosarcomas a few months ago. Another case, which is more recent, was Yofi, a 9-year-old intact male golden retriever who was presented for dysuria associated with inappropriate urinations. Back in August 11th, he was presented to these RDVM for a hotspot, to which he was given prednisolone, 20 mg per day. 3 days later, he was presented to his RDVM again for dysuria. They tried fluorouracil without any success. And then finally presented to us 2 weeks after, and his dysuria evolved to almost complete obstruction. Ultrasound was done and was unremarkable. Cystoscopy was done and was unremarkable. Contrast study was done and was unremarkable. And here you have the urethrogram. So we don't see like any mechanical obstruction. We don't see strictures. Yeah. So based on these exams, we suspected photo. It was discharged with alpha blockers and diazepam, and also because of the previous experience, I told the owner just to try to taper down the prednisolone slowly. And they called me back a month later saying, oh, the dog has normal urinations and with no medication on board. And then a last case, which is even weirder and don't really understand it, to be honest, but it's a 6-year-old neutral male mastiff who was followed for urinary retention. The owners were catheterizing a few times a day to help him peeing out. He had a normal cystoscopy and normal contrast study as well. We suspected E photo as well. He was discharged with alpha blockers, diazepam, botanical. No real improvement per the owners. And ultimately ended up getting some NSAIDs and acupuncture. And the owner said it resolved the whole thing. So they suspected it could be related to some arthrosis, although on the rats it didn't have bad hips at all. And then more recently, they called me back because they told me, oh, the dog had a hotspot. We tried local steroids and suddenly dysuria and obstruction again. And when they stop the local treatment, everything resolves. So those are three different cases that just puzzled me out. I just wondered why so many recurrent stories. Are there any drug-induced urinary retention described in dogs or in people? Could steroids be the culprit? And are intact males more at risk than neuter male? Because I had 2 out of 3 cases that were intact males. If we go through the human literature, we have only like few reviews about drug-induced urinary retention, one from 2023, one from 2008. And basically the drugs associated with urinary retention are anticholinergic drugs, antidepressants, alpha-adrenal receptor agonists, analgesics or benzodiazepines, NSAIDs, and calcium blockers. So if we go through the list of drugs, we can find some common names that we sometimes use as well in vet med, like amitriptyline, cyproheptadine, oxybutynin, atropine, some anesthetics, ketamine and bupivacaine, opioids, ketoprofen as an NSAID, diazepam, fluoxetine, diltiazem, and amlodipine. And we have different mechanisms that are suspected. So we have some drugs that are affecting the afferent and efferent signaling pathways, like opioids, benzo, NSAIDs, and serotoninergic. We have some drugs that are impairing bladder contraction, like the calcium channel blockers or anticholinergic. And then we have also some drugs that are increasing the urethral tone, like the alpha receptor agonist or the opioids. So basically, if we look at some drugs that we commonly use in vet med, we're going to have the anticholinergic like amitriptyline, cyproheptadine, or oxybutynin. And the mechanism of action is suspected to be a failure of cholinergic mediated bladder contraction. For the antidepressant or benzo, like fluoxetine or diazepam, it's going to be a detrusor muscle relaxation. For alpha agonist, would be a higher urethral sphincter tone. Opioids like morphine or fentanyl, it's going to be like a mu receptor mediated blockade of sensory input from bladder and increased bladder sphincter tone. And also there's a decreased sensation of bladder fullness and overdistension. For NSAIDs, it's more impairment of prostaglandin-induced bladder contractility. And then for the calcium channel blockers, it would be like to reduce the bladder smooth muscle contractility. Okay, so what about dogs and cats now? Well, unfortunately, in the vet literature, we have nothing really reported. We do have the ACVIM consensus statement on diagnosis and management of urinary incontinence in dogs, and where you can find that you have some disorders of voiding, and basically there's no mention of drugs anywhere. And so usually when we don't find anything, we just assume it might be like some idiopathic functional outflow tract obstruction or some weird neuro cases that we haven't found anything yet. Okay, so what about steroids now? Could this be the culprit of the urinary retention I've seen? So if we look at the human literature, basically, if we go through a Google search, we're going to end up in drugs.com, and they're going to tell us that more common side effects of prednisone are aggression, agitation, things we know about, but also a decrease in the amount of urine. Usually we think about corticoids as PUPD. Another website with this article, Can Steroids Cause Urinary Retention? They will say that yes, it can, and it can contribute to the development of urinary retention, a few different mechanisms. The main mechanism they propose would be like a weakness of the bladder muscles. They say that the risk is higher in older adults or individuals with pre-existing bladder or prostate issues. and then that it is more common during the initial stages. What's interesting is that the symptoms they describe, so you have eventually the frequent urination and PUPD, but also some difficulty urinating, like incomplete bladder emptying, weak urine stream, or a sense of straining during urination. So that reminds us a little bit about the dysuria that I have seen. Okay. If you look at the source of this article, the references, they're gonna end up at the Mayo Clinic website. And so when we look at that, the prednisolone side effects, we're gonna have the more common one, including the decreased amount in the urine. And then the other side effect we can see in VetMed as well. So what would be the reason behind urinary retention? Well, we have three possible pathophysiology that I could find. The first one would be linked to a muscle weakness. Okay, so corticoids and muscle weakness. Corticoids can act as a hormone and can basically alter the muscle production of IGF-1 while increasing the myostatin production. That will lead to inhibition of satellite cells activation and myoblast proliferation, and so a decreased protein synthesis and stimulation of proteolysis. So that means that the detrusor muscle could be weakened by glucocorticoids, like it has been described with other respiratory muscles, peripheral muscles, and so on. The only thing is that we would then expect the same outcome for the urethral sphincter, that it would be also like weakened by the glucocorticoid use. That's a bit weird. The activation of the AMPA receptor. So, okay, bear with me. AMPA receptors are glutamate receptors that play a key role in the lower urinary tract system and also in the control of micturition. At least it is shown in the rats. The glutamate is an excitatory neurotransmitter in the CNS, and we have two different receptors, the AMPA and the NMDA receptors. And so it has been proven that the use of AMPA or an MDA receptor antagonist in rats, both healthy and with spinal cord injury, would lead to a decrease in bladder contraction and also a decrease in urethral tone. So in this study, for example, they use a NDMA and a AMPA receptor antagonist. And so on the left, you can see that the bladder contraction will decrease after the drug administration in normal rats. And then on the right, we're going to see a decreased urethral EMG activity after the drug administration in normal rats as well. And we can already see that we have a more potent effect of the AMPA receptor antagonist than the other one. In spinal cord transected rats, there is an even more effective glutamate receptor antagonist versus healthy rats. So that would mean that potentially the glutamate receptors could play an important role in dyskinesia of auto patients. Also, the rats were more sensitive to AMPA receptor antagonist than NDMA, like we have said. And so AMPA receptors might play an important role in the pathosis of DSD as well. Also, in spinal cord injury rats, they showed that the use of an allosteric modulator of AMPA receptor can help them go from bladder atony to reestablished voiding and coordinated external urethral sphincter bursting. There were less non-voiding contractions and more complete voiding contractions too. And so that's what's shown in the graphs here. On the bottom left, we do see less non-voiding contraction and more complete voiding contraction. And we also see that after the medication, the second graph, we have a more coordinated activity of the sphincter. So basically, the modulation of the AMP receptor would play a role in micturition reflex and also gaining bladder and urethral tone. Okay, that's cool. But what's the link with the steroids? So we know that stress hormones and cortisol act like neurotransmitter on synapses. They are super, super important to be able to consolidate spatial and emotional information and memory secondary to stress. And glucocorticoids basically, they play a key role in behavioral adaptations and also to facilitate learning and memory processes. So how does this work? So basically, on your left, you have the baseline. So you basically have the synapse with the glutamate, and it's going to end up in the AMPA receptor. When there is a stress, we're going to have the activation of the synapse via the mineralocorticoid receptors, which is the orange box on the left. And that's going to increase the probability of glutamate to be released, and also the lateral diffusion of the AMPA receptor. If we have a high level of stress, of chronic stress, we're going to have even more glucocorticoids, and now they're going to activate the glucocorticoid receptors. So before, we had just a non-genomic action, which is quick. But then if we start activating the glucocorticoid receptor, we're going to have a long-lasting genomic action with the synthesis of more proteins and more receptors, incorporation of another AMPA receptor, and the lateral diffusion of this new receptor. Okay, so now I have even more questions. Since the AMP receptors have such a key role in the micturition reflex, would that mean that steroids enhance the synapses activity and urethrum that much? And shouldn't it increase the bladder detrusor activity as well? The third mechanism that I could find was the decreased sexual hormone activity, secondary to the corticoids. So we know that, sorry, this thing is in the way. So we know that corticoids and sexual hormones have many, many interactions, and that in the hypothalamus, the glucocorticoids inhibit the synthesis and the release of GnRH. In the anterior pituitary, glucocorticoids inhibit LH secretion as well, and glucocorticoid receptors are expressed both in the ovaries and testes, and that glucocorticoids act here to inhibit the gonadal steroidogenesis. So that means that if we have an increased CRH as a consequence of stress, it's going to inhibit the GnRH and have less sexual hormones as well. In people, it is rather controversial whether testosterone causes BPH or not. Why? Because we know that testosterone decreases with age, and also because the BPH diagnosis increases with age. So there's something that doesn't sound right. Also, we have some metabolic syndromes in people, which are characterized by insulin resistance. And we have, it is defined by an increased estrogens, which are pro-inflammatory, and decreased testosterone level, so hypogonadism. And all those changes lead to prostate inflammation and some remodeling that can lead to BPH. So this is written here. So you have the testosterone level going down, the estrogen going up. That's going to lead to some proliferation of the stroma and epithelium. And then for metabolic syndrome, we're going to have as well some aggravation in chronic inflammation, and it's going to lead to some proliferation as well. And so leading to BPH and lower urinary tract signs. If we think about it, the glucocorticoids use is similar to meds because we have visceral obesity, insulin resistance, dyslipidemia, plus minus hypertension. It's going to also decrease the testosterone production. It's hypogonadism. And so I just wonder if glucocorticoids if the corticoids could contribute to worsening BPH in male intact dogs that had already some BPH to start with. And that could explain why we would have like a sexual predilection as well. Also, testosterone, we know that this can improve bladder capacity and also the smooth muscle collagen content. If we don't have testosterone, the bladder wall is going to be thinner. Testosterone and its metabolites help maintaining the reflex activity in the pelvic part of the autonomic nervous system, and testosterone is responsible for NO production. And the NO is an inhibitory neurotransmitter, and it helps with relaxation of bladder neck and proximal urethra. So if we don't have testosterone, we don't have NO, we don't have relaxation of the bladder neck and proximal urethra. So testosterone is essential for the male tract development, but also for the maintenance of the functionality of it. So I just want to could steroids use lead to hypogonadism and decrease testosterone levels, essential for maintenance of functional urinary tract? Could steroid decrease NO activity by decreasing the testosterone and so leading to a higher bladder neck tone? Could steroids use lead to a metabolic syndrome-like condition, and so potentially could steroids worsen an already existing BPH? Okay, so let's wrap up because I'm pretty sure you got confused. So we know that several drugs have been associated to urinary retention in people. We have no report in VetMed. And those drugs are anticholinergic drug, antidepressant, alpha, adrenal receptor agonists, analgesics, and benzo, NSAIDs, and calcium blockers. We have no actual case report of corticosteroid-induced urinary retention, both in animal or humans, but it has been mentioned as a potential side effect on multiple websites, with symptoms like difficulty urinating and a weak urine stream and sense of straining during urination. Corticosteroids can affect the lower urinary tract via multiple ways. So we saw muscle weakness, mTOR receptor activation, and the decreased sexual hormones. And now if we go back to where it started, to one of my cases, Yofi. So remember, 9-year-old intact male golden retriever, got hotspot in August 11th, got prednisone, and then a few days later presented for dysuria, and 2 weeks later obstruction. We had normal imaging, cystoscopy, and contrast. So it is an intact old male. So probably this dog had some pre-existing BPH going on. He had no other urinary signs in the past. He had seen systemic corticosteroids just before presentation, and we couldn't find any mechanical obstruction. The thing is that we had only 3 days between drug exposure and development of clinical signs, so this could be a little bit short for genomic actions. Although I would say that the clinical signs got worse with time because we were from mild dysuria to complete obstruction. So probably, maybe the genomic action got the thing worse after. All right, that's it. That's all I have for you. So I wonder if you guys have any input for my cases. Am I making up a potential connection? If you guys are listening later on, you can just write me an email as well to discuss. That would be great. I wonder if any of you had any potential drug-induced urinary retention, any similar stories, anything that you can potentially connect to corticoids. I know Dr. Dunn had one that she might think about corticoids. And I would love to collect cases to discuss, maybe publish something as well, case series or whatever. And then I wonder if you guys see also some intact male dogs that are more predisposed to this kind of urinary retention versus other neuter dog or cats. And then, yeah, if you have any comment, let me know. Thanks for your attention. And again, feel free to email me as well.
Florian, I'll give you a
Yeah.
couple of comments. I thought you did a really nice job and I appreciated your atypical presentation. It was not too erotic and nerdy, I think, I think you are in a great group of bunch of really nerdy people. So you're in good company. I have not personally appreciated steroids causing urinary retention. At least I didn't recognize it, I should say. Um, I'm, I think I mean, I think, your three cases are interesting. It'd be interesting if other people, had similar experiences. And I think pooling those cases together, you could publish a case series. If you don't get any more that are really helpful, you did so much work and such a great job with this, and going into the background of urinary retention and the drugs we use in veterinary medicine. I think you could publish a review article on urinary retention in companion animals. And to my knowledge, I don't believe anyone has done that. I have seen drug-induced urinary retention on numerous occasions with opioids. And I do liver shunts at my institution, and I always tell the anesthesia team, do not give my patients long-acting opioids. They'll never metabolize it, and it's not a painful procedure because I do percutaneous coils. They don't need opioids for this. It's a jugular approach.
Mhm.
Inevitably, that doesn't always happen, and somebody gives the dog methadone or something like that. And I've had several who had a procedure and then who couldn't pee. And that's lasted, in some of them, up to 24 hours. And I've reversed their opioids, and then a few hours later, they could pee. So I do think that that's real. Um, and something that I've appreciated more than one occasion. Um, and I think there's, probably plenty of anecdotal reports of like amitriptyline in veterinary medicine causing urinary retention. I certainly see it more I see urinary retention issues with intact male dogs over others for sure. And my guess is it's not only everything you said, I think makes sense, but just any additional obstruction to flow and resistance through that urethra, I think will make any dysfunction worse. So that would be my hypothesis. And those are all my comments. Good job.
Thank you. Yeah, thank you so much for your comments. All right. I guess if that's anything, thank you for joining. And again, feel free to reach out to me. Have a good day. Bye bye.